the point one committee meeting to order. Start out with solid waste. Jolene?
Okay, we are seeking authorization to fill one part-time labor position in the solid waste department, and the vacancy is due to promotion.
I'll move that.
Got a motion?
Second, Rick.
Second, Ron Knott, all in favor?
Aye.
Opposed? Carried.
Thank you.
Thank you, Jolene.
See you, Jolene.
Next is our district attorney.
Happy New Year, everybody.
Happy
Hey,
New Year.
Paul.
How you doing, Paul?
You may remember, folks, that last year, Lisa worked very hard with Bill to get a grant for $200-some thousand. I'd like to spend a little bit of it this year to help with the discovery once again, both for computers. Our computers are kind of out of date, and also for a paralegal.
Okay, and this is 100% state funding.
Well, not exactly. It's from, the grant comes not from, it's not exactly from the state. It's from forfeited money.
Okay,
Okay.
Remember, it's not from Columbia County forfeited money, but it's complicated, but it's not our tax money, but we do have it.
okay.
Okay.
So I would entertain a motion to, this portion would be to fill the paralegal, create and fill the paralegal position.
I'll move it, Rick.
I'll second.
Second, I'm sorry, who seconded that?
Jim Guzzi.
Jim Fuzzy, all in favor?
Aye.
Aye. Opposed? Passed. Thank you, sir. And, Paul, tomorrow we'll deal with at the public safety meeting with, purchasing the computers.
Okay, thank you.
Yep.
You got to push your camera down more, Paul, so we can see you.
There he is.
There you go.
Got a flat tire on his chair.
Yeah.
All right, next is, our county clerk, Holly Tanner.
Good afternoon, everyone. Can you hear me?
Yes.
Yeah.
Okay. Can you see me? I guess I'll do what Paul did. There we go. So I am requesting authorization to fill 2 vacant budgeted motor vehicle cashier examiner positions in the DMV.
Move it.
Second, Rick.
All in favor?
Aye.
Aye.
Aye. Opposed? Carried.
Gracias.
Thank you.
Thank you.
Next is the Board of Elections.
Okay, so my deputy is retiring in February, and I'm asking to hire under the title election technician at a rate of $20 an hour, the person who will be taking my deputy's position. And this is just so that we have time to train her before she actually starts.
And you have, we discussed this, you have funding available in that election worker account.
We do, in our temporary employment line has money in it.
Okay,
Good.
so we entertain a motion.
I'll make a motion.
Motion, Jim Guzzi, second.
Rick.
Rick Scalera, all in favor?
Aye.
Opposed? Carried. Thank you.
Thank you.
Next is 911, emergency dispatcher position.
Good afternoon. I'd like to request to fill a budgeted emergency dispatcher 1 position due to retirement on 3/30 of 2022 and any backfill that's caused. I also would like to request to create and fill 1 temporary emergency dispatcher position as soon as possible until 3/31 of 2022.
Okay, entertain a motion.
Bill.
I'll move that. Hoatling.
Motion, Supervisor Holtling, second.
Second, Rick.
Rick Slater. All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you.
Public Works Facilities.
Good afternoon, everybody. Yeah, the first one is to fill maintenance worker position due to a resignation and any vacancies that are created due to internal promotions. That's one of them.
Move it.
The motion? Second. Second, Ron Knott, all in favor?
Aye.
Opposed? Carried.
All right, my next one is due to a termination, we're looking to fill a part-time labor position. That's been vacant since December.
I need a motion.
Move it, Hoatling.
I'll second it. Ron Knott, all in favor? Aye.
Aye.
Opposed? Carried.
And this one it was due, not due to termination, it was written wrong, due to a resignation, one full-time labor, and then any vacancies, which would be the part-time if someone moved up. So I'm looking to move that one too, to hire that one. That's been open since the beginning of the year.
I'll move that.
Jim Guzzi's motion, second.
Second, Rick.
Rick Sclera, all in favor? Aye.
Aye.
Opposed? Carried.
And then my next one is due to a resignation or looking to fill a senior building maintenance worker and any vacancies that may be created due to internal promotions.
I'll move it. Ron Knott, second.
Hoatling.
Supervisor Holding, all in favor?
Aye.
Opposed? Carried.
Thank you.
Chairman, could I ask a quick question? I am so sorry that I was about 5 minutes late. You guys move really quickly, but I did have a few questions on a resolution that I think already passed, but it might just be some typos. Should I wait till the end of the meeting or? Can I
Yes,
ask now?
yeah, why don't we get through this and then we can go. back.
Okay, great, thanks.
I believe Lieutenant Rivera is on.
That's affirmative, sir. I have 3 resolutions. By the way, Happy New Year to everyone. I have 3 resolutions on behalf of Sheriff Kraft, who's not able to be here based on a conference that he needs to attend with the New York State Sheriff's Association. But what I do have is looking to fill authorization for the Sheriff's Office to fill a budgeted vacant full-time position for Deputy Sheriff Captain, which was vacated by the retirement of Captain Bray.
Move it, Hoatling.
Second.
And
Is authorization.
all in favor?
Oh,
Aye.
sorry.
Aye.
And just so you know, we signed emergency fills on these for captain and for the security sergeant position. So I'm sorry, Captain or Lieutenant Rivera.
That's fine. The next one is authorization for Sheriff's Office to fill a budgeted vacant full-time position for Deputy Sheriff Sergeant. That's for Kraft retiring and be appointing sheriff. So we're looking to fill that.
Move it.
I'll second.
Who second? I'm sorry, who seconded that?
Simmons.
Okay, all in favor? Thanks, Greg.
Aye.
Aye.
Opposed? Carried.
Thank you. And the final request is going to be authorization for Sheriff's Office to fill a vacant budgeted full-time deputy sheriff position. This one is due to the untimely passing of Deputy Sheriff Bernard Roberts, which created that vacancy.
Okay, need a motion?
I'll move it, Rick.
Rick Scalera, second.
I'll second it. Simmons.
Supervisor Simmons, all in favor?
Aye.
Opposed? Carried.
Thank you. Those are the only 3 items that I was given to bring before this committee today, and have a wonderful evening.
Thank you.
You too.
Next is Kevin McDonald, Office for the Aging.
Good afternoon, everyone. Happy New Year.
The next, I have 3 upgrades that I'm requesting, and just before I get into that, last year we had received well over $100,000 through a grant known as the American Rescue Plan, and we had intended to include this in our budget back in August when we did our budget. Somehow, probably I think through some miscommunications on our part, they never made it to the right people. So we're, again, I'm proposing this, for this year. The first position is to upgrade our nutrition services coordinator from a grade 17C to an 18B. Through the course of the pandemic, she's done a fantastic job as far as making sure that our seniors are well taken care of as far as meals. She's established an emergency type setup in the kitchen, just in case if our kitchen ever has to be closed. And I can proudly say that no one's gone without a meal through this pandemic. So like I said, I'm just asking if we could, upgrade her to from a 17C to an 18B, which amounts to approximately $2,700.
I'll move it.
Second.
All in favor?
Aye.
Opposed? Carried.
Okay, the next resolution was to upgrade our assistant administrator also up to an 18B. And again, just like our nutrition services coordinator, she worked diligently at making sure that all of our programs and services continued despite losing a lot of volunteers. She was very instrumental in getting our home aids program, our home personal care aids program going. And she has worked closely with our nutrition coordinator as far as a contingency plan if our kitchen ever were to be closed. So again, I was asking that she be upgraded to an 18B. This also amounts to about $3,500.
Kevin, I have a quick question.
Sure.
So it says in the body of the resolution that it is offset by grant funds, but then when it says at the bottom, is this position grant funded, it's not checked yes or no? Is that just an error in?
Yeah, it must have been. Yeah, it must have. Like I said, this grant came through actually last year. We got it. It was for several $100,000, and we used some of it last year, and we carried the rest of it over to this year. And as I said, we had all intentions of doing this through the budget process, but like I said, we had an error in communications, and it never got through. So
would it be appropriate before it goes to the home committee to mark to check?
Well, hold on a minute, Tistria. With that, the whole position isn't grant funded.
right. It's just the upgrade. Just the upgrade. Right.
So for clarification, this isn't a grant funded position. This is a regular position. The
Right.
increase from the one
Is.
to the other is going to be covered under the grant funds.
Right.
So
maybe
that
we
would
can
still
check-
remain no.
So maybe we can check the no box before it goes to the home committee?
Well, it's saying, is this a grant funded position? No.
Right, the no
Yeah.
box isn't checked.
Only this little upgrade is
Right, so
grant
The
funded.
answer is no, which means that no box would get checked. I'm just saying to complete that part of the form before sending it to home committee. It says, is this position grant funded? And it's just not filled in. So it sounds like the answer to that is no. Maybe we can just check the no box before sending it along
Okay.
Or you could cross out the word position and put upgrade,
and say yes.
say yes.
Okay, thanks.
Yep, thank you.
I'll move the
Okay.
resolution.
We had a motion and a second, Kelly?
We do not.
All right, so we have a motion from Supervisor Holtling. We need a second.
Second, Rick.
Rick Sclair, all in favor?
Aye.
Opposed? Carried.
Okay, and lastly, we'd like to change the status of one. We have 2 transportation aides. One was full-time, one's part-time, and we would like to upgrade the part-timer to a full-time. This is due to a number of reasons, a lot of it pandemic related. We've had an increase in requests for people to go grocery shopping. We've had an increase in requests for people to go pick up prescriptions. We've also even expanded our program. We've actually taken people to to banks. We've taken them to social services for appointments. We've taken them to actually even to some nursing homes for people to visit their spouses. So, like I said, and this position, even though we have money through the aforementioned grant, we also have money available because we are not filling a vacant site manager position that we have open, and we're just going to substitute the money from that to make this a full-time position.
I'll move that.
We have a motion.
I'll second it.
We have a
Senator.
second. And before we vote, just, this is a position that this committee approved, the supervisors of
Right.
this committee approved as an emergency fill. So just, to give some context, so.
Right.
And I appreciate that, Mr. Chairman, because it really came in handy, especially when we had one driver out ill for a couple of weeks. So thank God we had him here.
So we have a motion and a second. All in favor?
Aye.
Aye. Carried.
Okay, that's all I have. Thank you.
Bob Gibson, Department of Social Services.
Good afternoon, everyone. Mr. Chairman, I just want to start out because as I look at the agenda here, it says DSS 4 positions, but I think that's a mistake on our part. We do have 5 here that I'll be asking for today. The first 3 are for the position of caseworker. We've had 3 resignations roughly in the last month. I know 2 of them are moving on to the state for some positions. I believe the 3rd is contemplating retirement altogether, but not entirely sure yet. So the first ask is for to fill 3 budgeted caseworker positions and any backfills created therefrom.
Okay.
Need a
I'll move
motion?
it, Holding.
Motion, Supervisor Hoatling.
Second.
Jim Guzzi. All in favor?
Aye.
Opposed? Carried.
The next request is for 1 child support specialist position. It's a grade 12A. This is due to a resignation that also came in recently. So I would just ask to fill that and any backfill created therefrom.
I'll move it.
Motion, Guzzi.
Second, Rick.
All in favor? Aye.
Aye.
Opposed? Carried.
The final position comes, so Jonathan Yeager moved over to the treasurer's office and left the senior account clerk position in SCU vacant. So I would just ask to backfill that or fill that now and any backfill that might be created from the filling of that.
I'll move that, Simmons.
Motion, Simmons, second.
Second.
All in favor?
Aye.
Opposed? Carried.
And that's all that I have. Thanks so much, folks.
Thank you. Next is,
I'm sorry, Bob, you had one about a clerk typist, to a
typist.
community services aide.
Oh, yeah. Is that something to address here? I'll absolutely do that.
Yeah,
Yeah,
that was something here. Yep. Thanks, Michael.
Okay.
Sorry, Kelly.
No, absolutely. And I wasn't sure if I was just going to wait till home committee on that. So I thank you as well. Now we have a number of clerk type positions that are grade 10.5. And we also have the same grade as the community services aide. And it turns out there's a lot more flexibility with the community services aide position in as much as they can not only do clerk typist work, but they can fill other needs in the agency. So we made a conscious decision that as the clerk typist began to resign and move on to other positions, we would slowly convert all of those positions over to community services aides. That way they can do a much larger spectrum of duties without any increase in the budget. So I would ask to do that. Recently, Kathy Han moved on or put her resignation in, and we'd like to now convert that position over to community services aide.
Commissioner, I have one quick question. Why would you need the wording in any backfills created therefrom?
Well, I really wouldn't. That's superfluous, and so I will ask to cross that off, if you don't mind. But it's really not going to create a backfill.
Okay, that answers.
And if I understand correctly, it's the same pay. It's just a different title that allows more flexibility.
That is correct.
I'll move it.
Motion Supervisor Holtling, second.
Second, Rick.
Rick Scalera, all in favor?
Aye.
Aye.
Opposed? Carried.
I'm sorry, if I could just make one comment to what Supervisor Scalera asked. In case another person within the department decided to apply for and get that position, you'd always want to keep in any vacancies. So say, for example, Bob, your telephone operator decided to apply
Oh,
for the
I see.
position. It may not be promotional. We just put those words in there so that you don't have to come back again and ask for another refill if you're fortunate enough to be able to promote someone or laterally move someone within the department. So it just kind of saves you a step. So that's why they always put that wording in these resolutions.
Okay. It doesn't look like a promotion. It looks like a lateral transfer.
Right. It is kind of a ground level position, but he has other ground level positions that people could be interested in maybe moving over to more of a service oriented type position. So we always advise to put that in there so they don't, otherwise poor Kelly would have 1,000 resolutions
Right.
each month. So
So if the people that made the motion okay with, we'll leave that in there.
Yes.
Yes.
Thank you.
Yeah, and I'll, once again, I'll thank Michael for that, and also for catching that. And I indeed will bring it up at home committee as well. Thanks, folks.
Thanks, Commissioner. Controller Bragg.
Hi, thank you. Seeking authorization to fill the Director of Accounting and Auditing position that's vacant due to resignation in October of last year.
I'll move that.
Motion Jim Guzzi, second.
Second,
I'll
Rick.
second.
Rick Scalera, all in favor?
Aye. Aye.
Opposed? Carried. And you're already, we authorized you to advertise it, correct?
It's advertised and it's until Friday. We've got a couple candidates already that have applied.
Good. Next,
Fill the vacant inventory clerk position that is vacant due to promotion of Marissa into Mike's position.
I'll move it, Holtling.
Second, Rick.
all in favor?
Aye.
Opposed? Carried. Jim, thank you.
Thank you.
Next is Jack Mabb.
Okay, so as many of you know, we have a Healthy Neighborhoods program. It's 6 years old at this point, just was renewed. It's been very popular through 2 different administrations. I think it will go on for quite some time. It was created to have environmental health technicians fill the roles. We were able to successfully do that for a good part of its life. Unfortunately, what we're finding is that the science requirement for the public health technician exam is starving off candidates, and this last time we didn't have any at all. So we approached Becky in terms of changing the title over, this rollover to something different without the science emphasis, so that we can actually advertise for individuals. The grade is a grade lower than the technician grade, but this program, we only get the money if we spend it. It appears that the noise we're getting out of the state is that we haven't been able to go out in the community because of COVID, that soon we should be able to start some more activity in this program. So this is to create 2 new positions that have already been approved by civil service and to fill them so we can start spending some of that money and getting some of this work done.
Jack, is there a reason that there's no amount for either grade 12 box next to it? There's a salary box that's empty, but also underneath is this position budgeted? Yes, but there's no amount. Is there a reason there's not a salary amount in there?
No, no
Okay.
specific reason. I guess I just left it out.
At the bottom, it says 41,524.
Right.
And traditionally, Supervisor, thank you for asking that question. I would verify those, but unfortunately, when I was home with COVID, I didn't have salary schedules. So traditionally, the department head, we would go back and forth with that. So that's why it wasn't filled in this time.
Do you mind before it goes to home committee getting it? Because I also see a 37,602 for a starting salary, so I'm just confused as to which it is. Do you mind filling that
I
in?
believe that's less than the 15% less. I believe that. Is that the case, Jack, or?
Yes, that's the 15%.
Okay. But we'll verify it and put it in the request.
I'll move the resolution.
I have the grade 12 salaries right here from the UPSU book if you'd like me to read those. So the minus 15% for a grade 12, 37,602. Grade would be 44,237.
Okay.
Okay.
Thank you.
I'll move it with that salary
Thank you.
included.
You need a second?
Second.
Again, Jim Guzzi, all in favor?
Aye.
Opposed? Carried.
Thank you.
Thanks, Jack.
That's it, Chairman.
Okay.
Chairman, could I just ask a question on the DA resolution? I don't know if DA Chaika is still with us.
Yes, he is.
Great. So again, and this might just be me learning how to read these forms, but it talks in the body of the resolution quite a bit about state grant funding, but then it marks that it's not grant funded. Is that in error and it actually is supposed to be, yes, it's grant funded, or does it just talk about the grant in more of a generic sense? And then this position is not covered by that grant funding.
He had, the DA had addressed this earlier. We had asked the question. It's not grant funding, but it's money that was
Recovered.
recovered funding, but it was issued by the state to the counties. So in essence, it is a grant, but it's not a grant because it's not state money and it's not county money. It's money that was, I guess, based on.
Yeah.
Got it. So the body of the resolution is referring to this funding so that we know that there is this funding that is potentially offsetting the cost, but it's not a grant funded position, but it's important to have that wording. Okay. And my other question is that the form also says that it's not a budgeted position. And I'm just wondering, because we just recently passed the budget, is this something new that we didn't know about and that's why we couldn't get it in the budget?
The money was in the budget last year. If you look at there's written in, it says resolution number 229 of 21. We received the money. The district attorney came to us after the budget process and with the request to fill the paralegal, and a lot of it's because of I'm not going to say bail reform, but because of discovery and the increased work that's come upon the DA's office. And I don't want to speak for the DA, but that was the reason he had talked to Ron Caponera and I about it.
So it was like a timing thing where he wasn't sure that its funding was coming through when we did the budget process, and then the budget was adopted and then the funding came through.
Yep.
Okay. All right. Thank you very much for answering those questions. Sorry I was late to the meeting.
No, you're welcome. We need a motion to adjourn. Supervisor Hoatling, will you stay on for a minute after everybody leaves?
Sure.
So I need a motion to adjourn.
I'll make that motion.
Jim Guzzi, second.
I'll second it.
Craig Simmons, all in favor?
Aye.
Opposed? Carried. Thank you all.
Bye,
See ya.
everyone.
I'm going to bring this Health and Human Services Committee meeting to order, January 18th, 2022, 4 p.m. My name is Denal Collins. For those of you who don't know me, I'm the supervisor from the town of Chatham, asked to be the new chairperson. Serving with me is Kathy Eldridge, deputy chair. Hoping to bring the same level of dedication and compassion that Rob Lagoni did to this position. So with that, I'll get rolling right away. Office of the Aging, Kevin McDonald, please go ahead,
Yes.
sir.
Hello, Supervisor. Pleasure to meet you. I don't think we've had the pleasure to meet each other, but Happy New Year and Happy New Year to everyone else. As you can see my agenda, I've got our monthly reports attached, which people want to go over at their leisure and get back to me on any questions. So if not, I'll jump right into the resolutions. My first resolution is request to contract with the Elizaville Fire Department for a period of up to 3 years at the rate of $350 per month to provide a congregate meal program for seniors. This is our senior site down in the southern end of the county, and it's actually just a renewal. We've been there for a couple of years now, and find that it's very nice down there. It's good, very conducive to our seniors.
I'll move that, Morel.
Unsecond it.
All in favor?
Aye.
Aye.
So carried.
Okay, my second resolution is seeking permission to contract with Care Manage for All LLC to provide a powerful tools for caregiver program for caregivers. This was a program we did last year for the first time, and it went over very well. There were a lot of caregivers that tuned in, and they found a lot of the information that they got from this program. It proved very helpful to them, and it kind of gives them an opportunity to talk with other folks who may be in the same situation. So we're asking, this money is budgeted, and like I said, it's not to exceed $5,200, and we'd like to renew the program for another try.
Questions
I'll
for
move
Mr.
Helsley.
McDonald? Second? Is there a second? I'm sorry.
Yeah, somebody seconded it. I'm not sure who.
I didn't catch it either, so can somebody second?
it.
Okay.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, my next resolution 3, 4, and 5. The next three resolutions. These are items that were inadvertently not put into our budget requests last year. We received a couple of $100,000 in funding through a program known as the American Rescue Plan, and part of that was to help with the COVID situation. And all three of these requests are primarily COVID related. And as I said, they were supposed to be put in with our budget this year, and somehow mistakenly through our mistake, we didn't get them to the right person at the right time. So I'm bringing them now. And the first one is to change the status of our one transportation aid from part-time to full-time. The request for rides has significantly increased through the pandemic, especially to grocery stores, pharmacies, and other various businesses and institutions. Like I said, and the chairman has signed off on a emergency fill, which came in very handy because our other driver was out sick for a couple of weeks. So again, and the money for this, we are not filling a budgeted full-time site manager position. Okay, we're not filling that this year, and we're going to use the excess money for that to help fund this from part-time to full-time.
I will say that I approved the emergency fill after consulting with the .1 committee, just to make sure everybody was okay with it.
Any further questions for Kevin? Yes, Brenda? You're muted still.
Is it being funded partially because you're not funding the position, or is it being funded because you're not funding the position and because of ARPA?
No, what happened is the position was part-time all along, and like I said, we are using American Rescue Plan money and or money from a position that we're not going to be filling to pay for the rest of the part-time
The
position.
difference.
Pardon me?
You're using the ARPA to pay for the difference.
Yes.
Okay, thank you. That's clear.
Okay.
All in favor?
Aye.
Opposed?
Did we, wait, who made the motion?
Nobody.
See, I'm jumping the gun here. Wet behind the ears, green.
I'll
All
move
right,
it,
do I have a
Morel.
motion?
Morel moves it.
I'm seconded.
All in favor?
Aye.
Aye.
Sorry, Chairman, I just thought I missed it.
All opposed? So carried.
Okay, my next resolution is to upgrade the nutrition services coordinator from a grade 17C to an 18B. Especially during this pandemic, she's done a super job as far as keeping the kitchen open through the pandemic. She's come up with a plan to increase the meals. We've got surplus meals in our freezers. We've got shelf staple meals ready to go in case if our kitchen ever has to close down due to COVID. And like I said, the money for the increase is about $2,700. This would also come from the same recovery plan.
I'll move it, Morel.
Second, Helsley.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, my final resolution is to promote the assistant administrator from a 17B up to an 18B. Again, like the nutrition coordinator, she's gone above and beyond making sure that all of our programs and services remain open. She was also instrumental. I know some of the previous board members would remember the year-long struggle we had trying to get a personal care aid program up and running, which we were finally able to do last year. And like I said, it's eliminated the wait time to get an aid into some of these seniors' homes. She was very instrumental in working that program up and coming up with the policies, procedures, et cetera. And she's also worked closely with our nutrition administrator to come up with a contingency plan should the kitchen ever close, as far as making sure that everybody gets their delivered meals. So again, like I said, requesting a small upgrade. This amounts to approximately $3,700. And this too would come from the funds through the American Rescue Plan that we've gotten.
Any questions for Kevin? Do I have a motion? Kathy, I see your hands up. All right, motion from Eldridge. Do I have a second?
Second, Morel.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, thank you, folks.
Thank you, Director McDonald. Okay, we're going to go into Department of Social Services, Commissioner Bob Gibson. Commissioner.
Thank you, Chairman. Good afternoon. A number of resolutions. The first being a resolution requesting to fill 3 vacant or soon to be vacant caseworker positions, grade 15, base salary $55,593, and any backfills created therefrom.
Questions? Do I have a motion?
Move, Helsley.
Do I have a second?
Eldridge.
All in favor?
Aye.
Aye.
Opposed? So carried.
And I should mention it, and it is on the resolution, those were due to resignations, all 3. The second request is to fill 1 child support specialist position, grade 12A, base salary $45,158, and any backfills created therefrom. And this has been created also by resignation.
Questions?
Move it, Morel.
Do I have a second?
Eldridge.
All in favor?
Aye.
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 Opposed? So carried.
The next request is to fill one senior account clerk position, grade 11A5, base salary 41,930, and any backfills created therefrom. This is necessitated by a lateral transfer from this office over to the treasurer's office.
Do I have a motion?
I'll move it.
I'm seconded.
All in favor?
Aye.
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 Opposed? So carried.
Okay, number 4 is a request for authorization to convert the clerk typist position, which is a grade 10.5, to a community services aide position, grade 10.5. This is the second time I've done that. Some of you will recall that it is my plan, as each clerk typist resigns and or retires, to convert the clerk typist position to the community services aide position. They're both the same grade, but there's much more flexibility with the community services aide position, in as much as they can do activities that are outside the clerk typist position and also the clerk typist position duties. But the clerk typist can only do the clerk typist duties. So it seemed to us it was the same grade, and it offered a lot more flexibility, that we would just go the way of community services aid as we move forward.
Any further questions for Bob? Do I have a motion? I'll move it. Do I have
Elsley.
a second? Kathy?
Yeah, second.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, number 5 is requesting authorization from the board to enter into an agreement with Azrak Abdullah for the position, for the purposes of translation services in Yemeni and Arabic. Currently, we do not have anybody that we can rely on to do those translations, and they become necessary for a number of reasons, including folks that are applying for benefits, but also we may have children or family services emergencies that come up, and we need to communicate with folks that speak that language.
I'll move it, Morel.
I'm seconded.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, the 6th request is for authorization to enter into an agreement with the Mental Health Association of Columbia and Greene Counties for the provision of a warming and engagement site and a field support team. So I'll give a little background on that. The county last year, as part of the project that's being headed by the Greenberger Center, asked a number of questions of myself and some of my fellow department heads about, what sort of services might be needed, and may help the community at large when it came to emergency response, and otherwise, and police response to some high utilizers of the system. And one of the things that came across was to enhance the multidisciplinary team that the community has together by assigning 2 specific workers to that position who could be checking in on high utilizers on a day in and day out basis. And it was decided by that working group and members of the board that was a good use of funds, and that we would go ahead and do that. So I simply coupled that and with the need for a warming center. As everyone on the call probably knows, once again, we don't have a homeless shelter, and that has many drawbacks. One of which is when we do put people up during code blue time of year, they too have to go into hotels, hotel or motel rooms. But once they do, they're not receiving any other services. They're simply code blue clients. So they go out to those rooms, and in those rooms they stay, and we just continue to renew those rooms. Other counties who have more capacity have open warming centers, and they are much more like community centers. They're open overnight so that folks can come in and they have a warm place to go and they can have a warm meal. But then they're also open for large parts of the day because days can remain very, very cold, and also a lot of these folks don't have activities, and it's preferable that they can engage in activities, engage with other folks, and not simply go back out onto the street. So sort of combining those two, the Mental Health Association has come up with and will be hiring the 2 caseworkers who will work very closely with these high utilizer groups, many of whom have a combination of mental health and substance abuse challenges, I'll say. So those workers would address that, but also these workers would have a place to bring a lot of these high utilizers to during the day and at night, either to the warming center, which would be located over on Green Street, at the church over on Green Street, or to the Apogee Center, which is over in the Fairview Plaza by day. So we really feel like this is going to offer an awful lot more to Code Blue clients, and also to high utilizers of the system who are not otherwise engaged with services. There might be a lot of questions that go with that. I'd be happy to answer that, but that's what the contract with MHA would do.
Are there any questions for Mr. Gibson? Yes, Brenda?
So how would we determine who would go to a warming center and who would go to a motel? Is there?
Well, at the moment, what would happen is we have what are considered Code Blue clients, right? And that's a no questions asked at this time of year. Even if you're not eligible for other services, even if you don't want your eligibility determined, but you need a warm place to go, you get that. And you get that by hotel room at this point. So it would be that population at the moment, along with the folks that MHA reaches out to by day. And that list of folks is generally determined by the adult multidisciplinary team, and quite often they are folks that are not utilizing other services. Not entirely, some are, but they're not. And that's the group that I see right now that would utilize the warming center and the Apogee Center. I'm hoping to demonstrate the efficacy of the warming center itself, and ultimately start to work once again towards going to a shelter system in Columbia County. We've had the conversation many times how that would be advantageous from a fiscal standpoint, but just from I would say, human services standpoint, it would be so much better to do that. And I would like to say that, or I would like to believe that the warming center is going to be able to demonstrate that.
So this is a stepping stone to an expanded services and population, really.
It really is, because it would even encompass those who are engaged in services and who are
Right.
eligible for them. We would take them out of hotels and ultimately, hopefully, get to the point where we have a full-on tier 2 homeless shelter in Columbia County. Those discussions are ongoing also with these projects that the Greenberger Center is overseeing. But yes, this would be a stepping stone.
Thank you.
Any further questions for Mr. Gibson? Do I have a motion?
Come on, committee.
I'll move it, Morel.
Do I have a second?
Seconded.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, and the final resolution is a request for authorization to enter into an agreement with the Salvation Army for the provision of a worksite sponsorship for eligible public assistance recipients. And we have a number of those, including with our own transportation department, with the Columbia Green Humane Society. It's just a way to get people back into the workforce through, volunteer work with these different agencies. It gets them back in. Sometimes it even creates jobs that way because they do such a fine job that, someone says, well, we're looking for somebody part-time. But in the meantime, what it does is it satisfies the state and federal guidelines to start to move some of these folks towards work. So, folks that would be eligible for this would already be working with our employment department and quite likely our homeless department. And it's a place for them to go and get experience and get work at no cost to the county. It's an agreement between the county and Salvation Army that they will allow our workers to go over there and utilize this.
Sounds good. Any further questions? Do I have a motion?
I'll move it, Morel.
Do I have a second?
Second, Helsley.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, well, thank you, Chairman Collins. I remain on, and as always, for any questions that may come up further down the road or any questions that may arise given the statistics that I've submitted for the month. So I will remain on the line for the rest of the meeting.
Well, while we're with you right now, does anyone have any questions for Mr. Gibson about his, the data he's proposed? Okay.
Well, I'll be on the line. Thanks so much, Chairman.
Thank you, sir. All right, then we're going to go right into Human Services with Director Dan Almasi.
Thank you, Chairman Collins. I appreciate it. I just want to wish everybody a happy new year. Also want to welcome those of you that are newly elected and those of you that are new to this home committee. I'd like to extend an invitation to anybody who would like to get greater familiarity with what we do here at the Department of Human Services. If you're not sure, if you don't know us, if you don't know who we are and what we do, please feel free to reach out. I'd be happy to sit down with you. I had the pleasure of sitting down with our new chairman and talking for quite an extended period of time, and I enjoyed getting to know him, and hopefully he enjoyed getting to know me and what we do here at the Department of Human Services. So this first resolution that you have in front of you has to do with COLA adjustment, cost of living allocation for several of the providers that we act as a pass-through for. So this COLA came in, and we need to make adjustments in terms of the state aid allocations that we offer these various providers: Catholic Charities, Mental Health Association, and Twin Counties. So I ask for your support on adjusting the overall 2022 budget to be in line with these COLAs.
Any questions for Mr. Almasi?
I'll move it, Morel.
Second, Eldridge.
All in favor?
Aye.
Aye.
Opposed? So carried.
This second resolution has to do with a pre-existing resolution around us contracting with Dr. Carlos Valle. He's our lead medical consultant. Due to a staffing issue that we have with our prescribers, he has offered to increase his hours from 21 hours to 28 hours. It's uncertain at this time as to whether I'll need to take him up on that offer, but I wanted to have things in place so that I could move in a nimble sort of way should I need to. This is time limited. He wants to do this. He's making this offer through the end of May 2022. And like I said, I'm not quite sure that I'll have to take him up on this offer, but I'd like things in place to be able to do so.
Any questions?
Brother.
Do I have a motion?
I'll move it, Morel.
Second it.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, this resolution has to do with expanding the membership of the Community Services Board. We are asking for your support for Amy Holdridge and Commissioner Bob Gibson to join the Community Services Board here in Columbia County.
Any questions? Do I have a motion?
Eldridge.
Do I have a second?
Second it.
All in favor?
Aye.
Opposed? So carried.
And this is just to renew an existing business associate agreement with Sun River, Hudson River Healthcare. This is an entity that's involved with our care coordination program. They basically changed their name, so that requires a new business associate agreement. So we're asking that you support this request for this, for us to engage in this BAA agreement with this entity that has just been renamed.
Questions?
Move it, Morel.
Do I have a second?
Those.
All in favor?
Aye.
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 Opposed? So carried.
So this next resolution also has to do with our prescribing needs. This has to do with a nurse practitioner, psychiatric nurse practitioner that at the moment is an employee but is retiring. And due to our departmental need, we're seeking to contract with her for a period not to exceed 6 months, 14 hours a week. So I ask for your support in this contract so that I can continue to provide the prescribing hours that are needed.
If I could, when we spoke about this, you had said that she had a pretty substantial caseload.
Yes. So what's happening is Kathy is serving approximately 125 individuals, and we'd like to maintain the continuity with that. So she is slated to retire as of this Friday. I believe that's the 21st. So given that she wants to stay on as a contracted entity, we don't want to disrupt her service to these individuals because with how lean we currently are with prescriber hours, that would put a burden on our remaining prescribers. So the idea was to, get permission from the county attorney's office around the contract and be able to move this along in an expeditious manner so that those 125 individuals wouldn't have to go without, contact with their prescriber. We just want to maintain that continuity.
I've asked the county attorney's office to look at it to see if we could do this contract on an emergency, almost like an emergency fill basis. And then if they give the okay, I'll be consulting with the budget work group .1 committee to move forward, to sign it at least.
Any further questions for Mr. Almasi? Do I have a motion?
I'll move it. Morel.
Kathy, you second that?
Yes. Yes.
All in favor?
Aye.
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 Thank you, everyone.
Opposed? So carried.
This resolution, I was asked to put this in place to support the county leadership funding the mobile crisis assessment team through the Columbia Green Mental Health Association. Some of you may be aware that MCAT, as it's known for short, lost some funding through DSRIP. DSRIP is an acronym that stands for Delivery System Reform Incentive Payment. They funded about $350,000 worth of MCAT's operating costs. DSRIP went away at the end of December 2021, so we needed to scramble as to how we were going to cover that gap. I'm very grateful that county leadership here in Columbia County has agreed to pick up half of that, with Greene County picking up the other half. So it's $175,000 for Columbia County, $175,000 for Greene County. And this, of course, is because MCAT serves both Columbia and Greene County. So this is going to help keep MCAT whole at their current level of service, which is 10 hours a day, 365 days a year.
In our ARPA plan, we have budgeted for this. Actually, we budgeted for this for multiple years, but we said at least to get it started that let's do a resolution for this year or for 2022. But so it's not coming out of county tax dollars, it's coming out of the ARPA funds.
Any further questions? Do I have a motion?
Helsley.
Do I have a second? I'll second it. All in favor?
Aye.
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 Thank you, everyone.
Opposed? So carried.
And you're looking at the overtime report, which starts out at $12,000. We used 1840.46, leaving us with a balance of $10,159.54.
Dan, I think you had one more thing on your
Yeah.
discussion. Okay.
Yep, wasn't sure if we were there yet, Kelly. Thank you. So the last thing I'd like to talk about is, I believe it was in November, I presented to the home committee at that time the situation that was occurring at the Valatia Medical Arts satellite location. In case you don't know, the Mental Health Center has operated a satellite location at the VMA for some time now. For various reasons, we are interested in dissolving that satellite. It comes at an expense to our department, and it's at the point where it's an expense that we for a while now haven't been covering. And with everything that's going on in terms of the staffing shortages that our department has experienced, I feel as the department head, it's best if we allocate all of our staffing resources here at Hudson, our primary location, so that we can operationalize the services such as our open access walk-in clinic, hopefully be able to meet the needs of the student body at Columbia Green Community College in short order, and other programs that we've not been able to operationalize because of issues related to the pandemic and workforce and others. So I'm certainly open to reconsidering offering a satellite in that part of the clinic at some point. But due to the fact that we cannot cover our costs, which hover around the $40,000 mark annually, and also because of the technology that's now available to us in terms of providing therapy. Let's not forget, prior to the pandemic, our choice was limited to face-to-face services. Somebody had to come in to receive therapy. Now we have face-to-face as an option. We have video, and we're also allowed to use telephone calls to provide therapy and be reimbursed for those therapeutic telephone calls. So needing to locate ourselves in a remote region of the county isn't as necessary anymore. Granted, there may be some people that still feel very strongly about being seen face to face, but at this point, I just can't justify maintaining that expense. So in November, I asked for your permission to take steps towards opting out of the lease. The lease ends in September of 2022. And in fact, I did hear from the landlords over the holidays telling me that if I was contemplating about not renewing the lease, they would like to know because they have someone that's interested. So that would work in our favor if I received your support to opt out of the lease, because we would likely, and I don't know this for sure, but we would likely not be held to the term of the lease because it seems like they have somebody that's interested in the space. So I bring this up again for your consideration. And I defer to you in terms of the direction that you'd like me to take.
Supervisor Eldridge?
I think I asked the question in November. I'm going to ask it again. How many people utilize it now?
Very few. There are 2 clinicians there. One is actually seeing clients. I checked with her. She's seeing maybe 2 or 3 a week. But I've asked her to speak to those clients and inquire as to whether they would be interested in coming into Hudson if they had to, or whether they would entertain receiving their therapy virtually through a video connection or telephonically. And the answer was yes.
Okay. And that's who it's all about, the patients.
Agreed.
We have our hands up from Germantown Supervisor.
Yeah, and you were saying that the clinicians that are there would then be transferred down to Hudson?
Right. The clinicians that are serving in Volusia are already doing their primary work duties here in Hudson. So the transition, would be seamless.
Okay.
It would, in fact, it would from a departmental standpoint, it would allow me greater flexibility to use those clinicians in different ways here in Hudson to operationalize some of those programs that we haven't been able to operationalize. And also in some cases, they would have greater hours in the evening to see more children and families after school here in the Hudson area.
So we may actually be able to provide additional services easier by doing this.
Right.
Thank you.
All right, so the best way to, PJ Keeler. You're muted.
Dan, I may have missed multiple things going on here, but have you looked into getting out of the lease early? Lots of times landlords will let you out of the lease, especially if they have somebody interested.
Right. So the suggestion that I received back in November from the home committee was to send a copy of the lease agreement over to the county attorney. Linnell Hopkins reviewed it on our behalf and basically came back to me and said, look, unless they allow you to opt out early, they can hold you accountable to it until September. So hearing from the landlords most recently that they have someone that's interested in the space, I think works to our advantage. I wanted to talk with this group, the home committee, before reaching out to the landlords and acknowledging that, yes, that is the direction that we might be going in. So if you have somebody, that's great. I wanted to just bring it back here first because that's what you asked me to do.
Okay, that sounds good. I guess we best do this with a motion. Do I entertain a motion to pursue the disruption of the lease and to consolidate the clinical services back to Hudson? I'm sorry, that wasn't the most articulate form, but someone has a revision, they're willing to offer it.
We knew where you were going. I'll make that motion, Morel.
Do I have a second?
Second.
Helsley.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, in that case, thank you very much for your time and attention, and please don't forget about the invitation. Please reach out to me via telephone or email. I'd be happy to meet with anyone that wants to hear more and learn more about the Department of Human Services. Thank you.
Thanks, Dan.
Thank you. Supervisor Adams, you had a question?
I did. Dan, could you just give us a brief update on the Red Door? Have they been able to hire or?
Sure, absolutely. Thank you, Supervisor, for asking. And I do plan on having my bi-monthly report available for the home committee next month. So just to rewind a little bit. Something that I reported on, I believe it was in November as well, is that there was a sudden departure of the executive director of Twin Counties, as well as the program director of residential services for Twin Counties. Please note that Twin Counties provides residential services for both men and women. The women's residence is in Greene County in Catskill, and the men's, of course, is here in Hudson at the Red Door on Columbia Street. So that was startling to many of us, including myself. I'm happy to report that the staff responded quite admirably in that members of the board from Twin Counties met with the staff almost immediately after those resignations occurred, and took the temperature of the room. And the staff basically said, "Look, we're here. We're going to do everything that we can to keep the day-to-day operations going." And they, in fact, did that. So they deserve a lot of credit. I'm personally very proud of all of them for doing that. And since then, they've been staying the course. Now, what's happened since then is that the board has reached out to the Addictions Care Center of Albany. ACCA is the acronym. And Addictions Care Center of Albany is a substance abuse provider in the Capital District. So they provide services, but they also have experience providing administrative and managerial oversight. So they've been contracted with to come in and to help kind of just stabilize things. So they have a person on site 3 days a week, and they also have their executive director, Keith Stack, who's very much involved. And some of you may know Keith. He's a Columbia County resident. So he's involved in the day-to-day just to help Twin Counties stabilize. In terms of making appointments as to who the next executive director is going to be, or who the residential program director is going to be, that has not been done yet. They're really just working on stabilizing things, getting the day-to-day worked out, drafting some new policies and procedures that didn't previously exist. And I think they're going to be, eventually working on filling those vacancies. They have Renee Pine, who is the previous residential director. And I'm sorry, not Renee came before the person that resigned. So she's not the one that resigned. But Renee has experience is what I'm trying to say. And she's offered to pitch in addition to her duties as clinic director of the Greene County, Twin Counties Clinic. So they have good people that are interim and filling in to help things move smoothly. So they're open for business. They're taking referrals. So, in terms of how this could have turned out, I think it turned out really, really well. This is an opportunity for Twin Counties to take a look at themselves, make adjustments, make improvements, and hopefully come out of this for the better.
No, thank you very much. Any further questions for Mr. Almasi? Okay, then we'll move right into the Health Department. Jack Mabb, you're up.
Okay, good afternoon. So the first resolution is the Healthy Neighborhoods Program. This has been a program we've had for the last 6 years. It's survived through two very different administrations. It's very popular in Washington. It's been funded for multi-years. Problem we're having of late in the last couple of years is that it was created with a public health technician filling the two roles that we have here. We're having a hard time getting candidates who can meet the science qualifications. So what we wanted to do was we created healthy neighborhood specialist positions. It's been through civil service and approved by civil service. This is a slight savings to the county because the technicians were 13As, and these are grade 12. What we're hearing is we haven't been able to go out and actually do the work because of COVID. What we're hearing out of Albany is that we should be able to start resuming in the spring. This is grant funded, so if we don't spend the money, we don't get it. So we would like to move forward and fill these two positions. I actually have a young gentleman, just recent graduate of college, who is interested in one of the positions.
Any questions for Mr. Mabb? Do I have a motion?
I'll move it, Morel.
Second, Eldridge.
All in favor? Aye.
Aye.
Opposed? So carried.
This resolution is an example of how fast things are moving in this whole COVID business. We've got emergency authorization through the chairman's committee to hire or work with the healthcare consortium to hire part-time people to help us with contact tracing calls. We were doing hundreds of them at one point in time, and we actually got some help from one of the staff of the consortium who she was great for 2 weeks. We actually got another person through the pipeline and who was here for 2 days, and then the governor and state health department decided that because of the sheer volume of cases we were getting, we didn't have to do contact tracing anymore, which means we didn't have to make phone calls anymore. I think that we need to follow through on this agreement with the consortium so that we can pay the small amount of money that went to these two individuals. But I don't believe that contact tracing is going to come back. I think this is part of the state health department and the governor's office beginning to let go and move us in a direction that COVID's going to be here. It's going to be endemic, and we may still, in fact, be contacting positives, but we're not going to be necessarily doing any of the contact tracing in the future.
Questions?
No.
Do I have a motion?
I'll move it.
Unseconded, Abdus.
All in favor?
Aye.
Aye.
Opposed? So carried.
So our preschool early intervention preschool program is in need of a bilingual service, if you will, to help with these interviews that go on in some of these Spanish-speaking homes. And this is a service that is got a lot of experience with other early intervention and preschool programs, and that pretty much comes pretty highly recommended.
Questions? Do I have a motion?
I'll move it.
I'll second it. Burrell.
All in favor?
Aye.
Aye.
Opposed? So carried.
So you have my environmental health report for the month of December. So much has changed since this report was generated. I'm sure there may well be some questions in regard to where we're at as far as COVID. I will tell you that 5 of our nursing homes have outbreaks right now. The Grand, we've got some updated numbers today. They're up to 125 residents out of 226 that are positive. They're up to 48 staff. Livingston Hills, the Fireman's Home, again, have smaller outbreaks, but it's gotten in there. We had 181 cases today, and that was a 3-day total. And I never thought I would actually say this, but I breathed a little sigh of relief that it was only 181 because we decided not to pull cases on Sunday and Monday. I expected over 300 today. So, is this part of the plateauing that the governor thinks might be happening? I don't know, but we did have a 212 on Saturday. So I don't know where we'll go from here. I'd like to think that we'll start seeing a decline in positive cases, daily cases. Any questions?
Thank you very much, Jack. Any further questions for Mr. Mab? Jack, I'm going to go into executive session in a few minutes after further questions. If you wouldn't mind sticking around, it's going to be for the Department of Health.
Okay.
All right. Do I have any questions for any of the directors this evening? Kevin McDonald, Bob Gibson, Dan Almasi, Jack Mab. Any further questions while Kelly consults the email? No? Okay. Thank you, gentlemen. Kelly, did we get anything?
No emails.
Okay. Then I'd like to pursue a executive session involving the employment history of a particular person. Do I have a motion?
I'll make a motion, Mr. Chairman.
I'll second it.
Okay, all in favor, going to executive session? Aye.
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 Okay, you should be good to go. As soon as
Okay,
Oswald.
Oswaldo's discontinued the taping.
Listen, nobody's keeping score. You did great.
Okay.
All right, well, terrific. Welcome back to the Health and Human Services Committee. Just one last round, if anyone has anything to say or any further questions. If not, I'd ask for a motion to adjourn.
I'll bring it up. There you go.
Second it.
All in favor?
Aye.
Good night, everyone, and thank you.
Good night.
Thank you.
Good job,